Good morning, student. Today I teach the chapter 4 Physical Education and Sports for CWSN, like children with special need. Last video I sent the topic for the concept of disability, concept of disorder, and types of disability. Four types of disability you can. Okay. Now today I teach for the types of disorder. Five types of disorder, like first is attention deficit hyperactivity disorder called ADHD, and next sensory processing disorder, and third is autism spectrum disorder, okay, like SSD, ASD, and fourth is oppositional defiant disorder called ODD, and fifth is obsessive compulsive disorder called OSD. Now, first disorder, attention deficit hyperactivity disorder. This kind of people who are the hyperactive, and they are hyperactive behavior. Okay, this is common disorder. They can see the symptom for the flicking mind, difficulty for the following instruction, difficulty in learning in something new, lack of concentration, easily distract their mind, unable to sit quietly, continuously in motion, extremely impotent, throwing things, running violently, creating nuisance. This kind of people can do. Now, some cases for ADHD is this by the genetic factor. First is genetic factor. Okay. Now, second is impaired parental care, parental care, and head injury. This type of disease is the genetic factor, like parents, both the parents are suffering from ADHD, the children the most likely to inherit disorder. Okay. Impaired parental, in case of where there is the difficulty of pregnancy, this kind of people can do the very low weight, one is very low weight, there is a high risk for the ADHD. Okay. Now management of ADHD, again the counseling, behavior therapy, manner and okay, and lifestyle change, medical treatment. Okay, this is the major manage the this type of behavior, like hyperactivity behavior. Next is sensory processing disorder called SPD. This type of people, so many difficulties for the touching sense. Okay, this type of people, hearing, touch, and work coordination and balance for body, over oversensitive its sound or odor. The person does not respond the extreme heat, cold or pain. The person may be observant sensitive, oversensitive or undersensitive. Okay. Now the definition of this disorder is the SPD is the traffic jam with the prevents certain parts of the brain. They from receiving the information needed to interpret sensory information correctly. They cannot give the proper uh, proper sensory information, okay, or correctly. Now these cases of SPD is the genetic factor, birth complication, and environmental factor. Okay, genetic factor means that they do the one one person to another person give. Birth complication is the impaired parental care of the complication of during the birth. Child, like lack of oxygen supply to the child's brain, low birth weight, impaired development, etc. This is the responsible for the this disorder. Okay. Now management for the this disorder, SPD disorder, occupational therapy and sensory stimulation. This is the management for cure for the, we can do cure the occupational therapist the prepare for the cure for this disorder. Now third is oppositional deficit disorder called ODD. This type of cases of the disorder is the student or per people is the younger, okay, irritable, irritable, and oppose the others. Okay, this behavior we can defend anytime there is fighting mood. Okay, this type of disorder like frequent outburst of anger and resistance, repeated temper tantrums, not complying or activity refusing to accept requests or rules. Okay, being spiteful and seeking revenge. Okay, this type of disorder, tendency to blame others, feeling the frustration and anyone's. Okay, this is the ODD, people person. This is a mental disorder. Main type of a mental disorder. They can individual oppose others, become angry and irritable, anxious, or anything. Now, cases of disorder is genetic, biological, environmental. Some people are the biological family has history of mental illness like ADHD, the risk of developing ODD. Okay, those people that family has is the mental illness or the problem like ADHD, the risk of developing for ODD. Now next is environmental factor. Factors like disturb family life, abuse, neglect, harass discipline. This can responsible for ODD. Now the management of ODD is counseling, family therapy, social skill, and medication. There's so many types of the we can manage for the this ODD person. Okay, this number 4. Now next thing is autism autism spectrum disorder. Okay, this is the autism spectrum disorder means this type of people is the inability to express their needs, emotion and experiences, cannot develop friendly or social relation with other, repeat words, phrase or action, usually do not express their interest and behave sensitive to small taste and sound. This type of people is the autism disorder person. Now, you can cases of autism is genetic, other disorder. First is genetic person and brain development. This is the main case of the one of the brain development is the one of the case like autism disorder. Okay. Now you can manage further this disorder like medication and behavior therapy. Behavior therapy means therapy children with autism in early stage is very beneficial. Therapists help to developing learning, social and communication skills in the children. You can this type of people give the good for the cure like behavioral therapy like early age since the developing learning and social and the communication skill. Now this is the okay. Now fifth is obsessive disorder. Obsessive compulsive disorder called OCD means this type of people is the characterized for the anxiety disorder corrected by the recurrent obsessions for compulsions which the serve through to interfere significantly like personal or social they can interfere the thing like this system is the doing this type of people is the checking thing repeatedly person with OCD were not able to control their activities thought they feel the urge to perform compulsive ritual. Okay, they cannot focus on specific matter. Cutscene the one thought the unpleasant and embracing. Okay, they can do the disorder like you can do the hand washing properly, like close the door or not, check the properly time to time. You can do the checking for the doors. This type of people repeatedly they can do their activities for the obesity compulsive disorder. Like first is the now genetic factor. Cases of genetic factor. This they can found any person suffer from the OCD is the past they can do heredity for the genetic factor. Now next is neurological factor. We can do some neuro problem for that responsible for this transmission for the and information from one cell to the brain. The other may be responsible for this disorder. The brain, the people suffering from this disorder function differently. Now next is environmental factor. Okay, physical or mental factor. Sudden change in the living condition. The sudden loss of someone dear or illness. Okay, may be responsible for disorder. Now management of this disorder is counseling or therapy and medication. Okay, now this is the 5 type of disorder. First is ADHD, second is SPD, third is ASD, fourth ODD and OCD. Now some equities, disability equities. Okay, like the disability equities is the so many things, like disability equity is the disabled person. We guide so many guidelines for the this type of approach people with disabled person. Like this first is talk directly. Okay. Now offer to second, explain before conversing with visually impaired, ask before you help, address them by their first name as with others. Okay. Now don't touch or lean on wheelchair, listen them carefully and offer for help or assistance. You can go. Those people who are blind know how to orient themselves when they round the street. Their component, the table sign, so they may use can for the guide dog. The person have a visual disability that is not obvious. Be prepared offer assistance. For example, is reading with ask. Okay, you can do for the blind people. Speak clearly and slowly and relax while assisting, helping them. Now this is the disability equity. Yeah? To prepare for the disabled people. Okay. Now another thing is the first wheelchair equity, the visual equity. Okay. Now hearing disability equity, learning disability equity and speech disability equity. Now student, another is the strategic. Now next is the strategic to make physical activities. Okay. Here now next is the strategy to make physical activity. This step is the strategic needs of certain strategies given by developed to make a physical activity accessible for children with special needs. These strategies are adapted according to the interests and abilities of such children. Okay. Now first is the strategic should be is the consideration of individual needs. Okay. Now modification of equipment, change of the environment, modification in rules, modification in guidelines, studies, training of educators, supervision of medical staff. Okay, this is the equity study activity. Okay, now is the simple ways activity according to individual activities, modified equipment, simple and easy rules, motivate to the participate fully, well instructed and trained properly, encouragement from spectators, suitable environment, participant and the expert. This is the topic for the studies for the physical activities. Now student, this is complete for your chapter 4 Physical Education Sports for CWSN with children with special need. Now student, any doubt or any problem, you can ask me. Have a nice day. See you tomorrow, next week. Okay, bye bye. Okay, bye bye. Okay, okay.